would be, oh sorry, Dr. Radha K, and he would be presenting on clinical profile of uveitis in treated histopathologically negative Hansen's disease.
Good afternoon. The title of my topic would be Clinical Profile of Uveitis in Treated Histopathologically Negative Hansen's Disease. The primary aim of my study was to identify the type and clinical nature of uveitis using a smear, polymerase, and real-time polymerase chain reaction analysis of the aqueous humor, and to detect the trend of uveitis after completion of treatment in these patients, and also to identify causes of blindness in Hansen's disease. So this is a prospective cohort study conducted on 120 eyes of 180 patients, done in concurrence with departments of dermatology and microbiology. After informed consent from the patient and ethics committee approval was obtained, a routine slit lamp examination along with IOP, tear breakup time, Schirmer's, Bell's phenomena, corneal sensation was done. Blood investigations, a purified protein test, and chest X-ray were done for all patients. And all patients who were recruited into the study had completed treatment for Hansen's disease, and a split skin smear microscopy was done to confirm the same. Polymerase chain reaction and RT-PCR of the aqueous humor sample was performed according to the indication. We used the Zeal-Nielsen Carbon fusion stain in recurrent and recalcitrant uveitis. PCR was performed and RT-PCR on 5 patients. Follow-up was done for at least 3 years, and during each visit an entire evaluation was done. And the statistical analysis was done using a chi-square test and SPSS software. So the incidence of uveitis was 39% in our study group, which is 46 of 120 eyes, with blindness in 9%, and this was reversible in 6% of patients. Acute anterior uveitis was seen in 21 and chronic in 79, bilateral in 72% and granulomatous in 83%, along with cataract and nodular scleritis in a significant number. 43% of patients with uveitis belonged to the lepromatous group, 12% were indeterminate or borderline, and 45% were tuberculoid leprosy. After completion of treatment, the onset of uveitis in the paucibacillary type occurred within 1 year, 9%, 2 years in 33%, and 3 years in 11%. The multibacillary form of leprosy had recurrence of uveitis only 1 year after completion of treatment. So this is some of our patients, some of our study patients, in whom it was almost a uniform chronic granulomatous type of uveitis, and almost all of them had sphincter atrophy with a dilated pupil towards the, as we were approaching the end of the study. So of the 49 eyes, 12 samples were analyzed using PCR because they wouldn't respond to topical or oral medications, and the uveitis persisted, and PCR analysis showed the presence of detection of DNA bacilli in 5 cases, and of this 4 belong to the tuberculoid type and 1 to the lepromatous type. This is a quantitative real-time PCR of Mycobacterium leprae, which was done by the microbiologist. And the number of positive PCR patients, of the 12 patients studied, PCR showed that it was positive in 1 which was lepromatous and 4 tuberculoid, and the real-time PCR conducted on the same 5 samples was found to be positive in the tuberculoid type or the paucibacillary type alone. So a smear from the aqueous humor in some of the patients was found to yield a positive result, and this picture shows a granular beaded fully formed acid-fast leprabacillus which coexisted along with a live bacillus. So this drawing us to an inference that complications are that we saw in our patients for band-shaped keratopathy, spheroidal degeneration, complicated cataract, heel keratouveitis, and a festoon pupil. Again, some of our patients with long-term pannus, logophthalmus. So the picture, the scatter plot of our study population depicted here, which shows that the uveitis was mostly chronic in nature, and the multibacillary type of uveitis was seen to occur later, in the later stages after completion, but paucibacillary occurred early. So the inferences that we drew were that PCR analysis of aqueous humor reveals that uveitis can present or persist in Hansen's disease even after completion of treatment when staining and microscopy of the skin specimen is negative. Patients have been delivered as negative and have been negated from systemic management because skin lesions are not positive anymore, but they continue to harbor bacilli in the aqueous humor, giving rise to a chronic low-grade inflammation. RT-PCR can confirm the presence of bacilli in recalcitrant uveitis, and positivity rate of PCR for the paucibacillary patients was 42%, which is about 3 times higher than the multibacillary type, 12.6%, and this was found to be statistically significant with p less than 0.03. So in conclusion, uveitis, the majority of treated leprosy cases belong to the non-infectious or tuberculoid or paucibacillary type of disease as against leprosy or lepromatous leprosy prior to treatment. So before treatment is started, uveitis is much more common in the lepromatous multibacillary type of group. Longer duration of treatment may be required even in the paucibacillary type. As of now, they are being treated only with 2 drugs. Association with elevated inflammatory markers such as immune-mediated disease as a cause of scleritis. Chronic low-grade anterior uveitis is the commonest cause of blindness in leprosy, and in our patients we found phthisis and scarring following keratouveitis to be the commonest cause. These are my references. I would like to thank the patients from Rising Star Leprosy Home, Chengalpet, Tamil Nadu, for their participation. Thank you very much for your time.
To be there in the
Yes, ma'am.
patient system, both in the eye as well as in his body.
Yes, ma'am.
And tuberculoid leprosy is, as you rightly mentioned, it is paucibacillary, and specifically in tuberculoid leprosy, the bacilli is likely to be only in the nerves,
Yes, ma'am.
nor nerve sheets. But here, in contrast to that, you have positive RT-PCR in tuberculoid leprosy, but negative RT-PCR in lepromatous leprosy.
Yes, ma'am.
How will we explain that?
Ma'am, probably the paucibacillary status, the patients receive less treatment, ma'am. They get only 2 drugs, and it's for a shorter duration. And all medications towards leprosy are aimed towards skin lesions. So sometimes there are just single or few lesions where treatment is addressed only towards that. So it's probable that the load in the eye is actually more than the rest of the body.
Okay. Okay.
Was it a standard line of treatment, systemic treatment, which was given to these patients, or
Yes,
there was
yes,
there
ma'am.
were variables?
Yes, ma'am. All patients with multibacillary got 3 drugs for 1 year, and all patients with paucibacillary got 2 drugs for 6 months. That was followed for all patients. And we saw patients at different times. So some of them came to us after 6 months, some came after 8 months, but we followed everybody up uniformly for at least 3 years, ma'am.
So uniformly, these patients have come at a later stage to you all, when they have had manifestations. in the eye
Whenever
which
they
is
had
significant.
symptoms of any eye disease, eye pain, they were brought to us, ma'am.
Okay.